Okay, students, now we're going to go ahead and we're going to cover the deep muscles of the back and shoulder. Just a quick reference check to remind you all the superficial muscles that we're going to need to bisect to make sure we see these deep muscles. Again, we're going to get right here the spinotrapezius, right here the acromiotrapezius, and we're going to move somewhere into, or a little bit into, the clavotrapezius. So, getting our references together, the muscles that we're going to cover are the supraspinatus, infraspinatus, teres major, rhomboid, rhomboid capitis, splenius, and subscapularis. So, to end up doing this, we're going to, again, remember to keep a superficial side of those back and shoulder muscles. Now we're going to do a deep side. So, as we go through the border between the spinotrapezius and the acromiotrapezius, now we just want to kind of cut through some of that connective tissue so we can get underneath the acromiotrapezius, and you just want to use your blunt probe and kind of loosen that muscle from any of the tissue just lying underneath that. And as you take your scissors and cut through the acromiotrapezius, again, it's a bisecting cut, so we're leaving half of the muscle to be reflected laterally and half of it to be reflected medially. You'll notice I'm just going through some of the remaining connective tissue. You can also just pull this off with a gloved hand. And just underneath, the first muscle that we're going to look for is the supraspinatus. Now, the supraspinatus has an origin of the fossa above the spine of the scapula and an insertion of the greater tubercle of the humerus. So, again, to orient yourself, the humerus is right here. Scapula, you can feel the spine of the scapula right here. So if it's going to be the fossa above the spine of the scapula, that would be this area. So this muscle just under the acromiotrapezius is your supraspinatus, this entire chunk of muscle. So the infraspinatus is located or has its origin in the fossa below the spine of the scapula. That's also going to go and insert on the greater tubercle of the humerus. So what's going to be a little difficult is remember that the acromiotrapezius inserts also right at the acromion of the scapula. The best way to do this is kind of snip down again between the border of the acromiotrapezius and the spinotrapezius, and to try and snip a little bit of the acromiotrapezius away from the spine. You use your finger or your blunt probe to get just underneath that. You can feel the spine of the scapula. And there, this body, which is not the entire muscle, but this is the infraspinatus. Remember, supra refers to above, infra refers to below. So the supraspinatus, or the muscle above the spine, and the infraspinatus is the muscle below the spine. The next muscle that we're going to look at is the teres major. The teres major originates at the posterior border of the scapula and inserts at the proximal end of the humerus. So we're looking for a muscle that's going to go along, and you can feel the posterior border. Remember, it's a deep muscle, so it's going to lie underneath these superficial muscles. Right now, I'm kind of angling the blunt probe under the insertion right here of the spinotrapezius coming out just above the infraspinatus and under where the clavotrapezius would be. If I cut just along my blunt probe, now watch your fingers if you're pointing scissors towards your fingers, and removing that insertion of the spinotrapezius, peeling the spinotrapezius away and getting to that posterior border, all the way to the posterior border of the scapula. You might at this point go through the spinotrapezius, again trying to bisect it. We will get to a small muscle, which we'll see is the teres major, right here. Okay, so remember, humerus up here, posterior border of the scapula, nice little fat deposit right here, just posterior to it. And there is your teres major. Okay, coming right around here. Okay, so far we have supraspinatus, infraspinatus, and teres major. Okay, coming around to the humerus. Okay, our next muscle is going to be the rhomboid. The rhomboid will insert on the spines of the cervical and thoracic vertebrae, originate there, and insert at the medial border of the scapula. So, as you will notice, again, up to the bisected clavotrapezius, we're going to reflect this a little bit more and then cut into, the acromiotrapezius, and cut into the clavotrapezius. Got a little ahead of myself. And we're going to remove or kind of go through some of this connective tissue in this area so we can get a clear view. Removing some connective and fatty tissue. It would not just come off in my fingers if it were muscle, so don't worry. If you're using your fingers and not necessarily a sharp utensil, muscle will not come off. Okay, so we're looking for a muscle, again, that's going to originate on the cervical and thoracic vertebrae and is going to insert all the way on the medial border of the scapula. Again, you've got a really good advantage in papulating this scapula. So you'll notice the muscle fibers that run right here from the spines of the thoracic and cervical vertebrae all the way to the medial border of the scapula. This muscle is your rhomboid. Your rhomboid, okay? The next muscle is your rhomboid capitis. Origin is going to be the occipital bone of the skull all the way to the medial border of the scapula. So it's going to insert the same spot that the rhomboid muscle inserts. So the capitis, mind you, is going to go up further to the occipital bone of the skull. So you can see that there's a small portion of the rhomboid that looks like it is a strap that goes all the way up to the back of the cap of the skull. So that's your rhomboid capitis, which is different from your rhomboid muscle. Okay, and the last muscle that we're going to find is, the splenius and subscapularis. So the splenius is going to have its origin as the fascia of the neck and its insertion on the occipital bone. So the fascia of the neck, underneath here, all the way to the occipital bone, here is your splenius. Also remember, students, this is the muscle that you're going to find that's almost like a kitty neck warmer. And it's going to be just below the rhomboid and the rhomboid capitis. So here's your splenius. Now the subscapularis is going to be our final muscle for this section. And the easiest way for you all to find the subscapularis is just going to be able to look directly underneath the scapula. If you pull the scapula kind of laterally, and remember, we started off with our supraspinatus. You see the muscle that's just right here. And if you remember the scapula as a bone, there was a nice dish-shaped impression on the medial surface. That's going to be the subscapularis. If you run your fingers just underneath the scapula, the muscle that's directly on that bone, underneath, filling up the subscapular fossa, is the subscapularis. We're going to start off with the supraspinatus in orange. In purple, we have the infraspinatus, the teres major, gonna do in white, the rhomboid, I will do in yellow, the rhomboid capitis in green, the splenius in blue, and the subscapularis I'm going to do in white and yellow. And remember, that's just underneath the scapula as a bone. Okay, so as a recap, I will go from medial to lateral with these muscles: rhomboid, splenius, rhomboid capitis, subscapularis, supraspinatus, infraspinatus, and teres major. That's the end of the deep muscles of the back and shoulder.